I believe that I was blessed with a lot of things, and it's very, very important for me to share what has been given to me. I have always believed that, what God gives you is God's gift to you, but what you give back is your gift to God. And I always believe that we always have a choice in how we use the talents that are given to us, or the things that are given to us. And I believe that being in a place where I am needed, where children get to see and benefit my expertise is, one of the greatest things that anybody has the great opportunity to do. This is the toughest question that I could ever think about. I'm Doc Mae. I'm a pediatric oncologist. I love people, I love children, I love life. So I wanted to be a doctor since I was 9 years old. And there was not anything else that I really wanted other than be a doctor. I was actually staying as far away from oncology as I can. My mom died of breast cancer when I was 17, and as a young teenager, it was a very traumatic experience for me, looking at how my mom suffered and how helpless I was, because I was just a student, I was just a teenager. But when I went to Singapore and I saw a team who were not only very good at what they were doing, who were not only scientists, but were also practicing the art of medicine, I thought that was the kind of doctor I would like to be. And I felt that my own personal experiences made me a better doctor, because I understood how families felt when somebody in the family is diagnosed with cancer. When I tell the parents that I know how you feel, I'm very sincere about it, because I've been through the journey as well. Oh, I love kids. I'm a child at heart. I always like children because, probably because I'm also like a kid. I am straightforward. I say what I feel. When I'm happy, I'm happy. When I'm sad, I'm sad. And I just like being around kids, and I enjoy going around, looking after kids, talking to them, talking to parents. I felt that, it's one of the best jobs in the world, and I'm happy doing it. When I went overseas and I saw kids with being diagnosed with cancer and getting better, being cured, growing up and having kids themselves, I felt that it was something that was really worth doing. And if I can do it and go back to the Philippines and do it in Davao, I would love to do it. Cancer in children is highly curable. I've seen that. I've seen children being diagnosed with cancer, getting cured, and I believed in that. Unfortunately, when you come to countries with limited resources, not only the Philippines but other countries also in the region, there are a lot of barriers to care. There are a lot of barriers for kids to have equal chances for treatment. And unfortunately, even if pediatric cancer has survival rates of more than 80% in developed countries like the US, Japan, or Singapore, unfortunately in the Philippines, nationwide, I think our overall survival is only less than 20%. there are very little resources. Kids are very sick. I didn't have anybody with me, but it was something that I felt I had to do, and I went ahead and did it. Filipinos love children, and they are always the center of everything that we do. And when a child is diagnosed with cancer, it basically just devastates the whole family. And this is the reason why it has always been my view that it's not only the kid that we are looking or taking care of, but also the whole family. I have seen lots of parents who do not have any money, who have lots of difficulties, but who believe that their children can be cured. And that simple belief is not only very inspiring, but it has helped a lot of kids get better. So I believe that it's not just medicine, but also how the child is looked after and how the family believes that the child could be better. It's a very important ingredient in trying to look after a kid with cancer. Mindanao, as we know, has some of the poorest provinces, as many of the poorest provinces in the whole country, and access to care is very difficult. And some of the patients, when they are diagnosed with cancer, a lot of them go home and do not want to continue with treatment anymore. So treatment abandonment is a big problem with us. And another major problem is patients come in late stages of disease because of financial challenges, the difficulty of coming to the hospital, not knowing where to go. So this contribute to the fact that we have a very low survival rate for child cancer, particularly in Mindanao. When I first came in 2004, our overall survival was less than 10%. A lot of our kids are being diagnosed, they don't go into treatment, and even if a lot of them would go into treatment, many of those kids will also drop out of treatment, and that's really very sad. I get very frustrated when patients are diagnosed and I know that I can cure them, and families would decide not to continue with treatment, or families will just drop out of treatment, and then they would come back to us with kids having relapsed disease in severe pain, huge burdens of cancer. I feel very sad for the kids, and that really frustrates me. There were families who were sleeping on the floor or under the bed because they have no place to stay. And the patients would stay in the hospital for long periods of time, even if they're supposed to be discharged, because they have nowhere else to go. And they have to come back for the next treatment. Sometimes our treatment protocol would need for them to be going back and forth to the hospital 3 times a week. So if you live like 8 hours away, that could be very, very challenging. And a lot of the parents just give up. I felt very, very sad. I thought that, you know, I why am I trying to do this? Why am I treating cancer when I couldn't even provide decent accommodations for this very young family? And that's when the idea of having a transient home for children with cancer came about. That became a place of hope for most families. It was able to help decrease treatment abandonment because children had a clean, wholesome, and nice environment for them to stay. We do not provide free food at House of Hope, and the families, they help clean the place and keeping the place secure, because that's how they should feel when they're at home, right? Our treatment abandonment decreased from 90% to 20%, and our survival rates was improved from 10% in 2004 to 50% at the moment. And this is despite the fact that the numbers of the patients that we are seeing was more than 10 times what we were seeing in 2004 when I first came. So it has become not just a symbol of hope or not just a home for the kids, but it has become a sanctuary for children and a place where the community can learn more about pediatric cancer. It takes a village to really take care of a child with cancer. It's not just the doctor, but it's also the people around them. It's the nurses, it's the support team, it's the palliative care, it's the child life. So it takes a whole village to take care of a kid with cancer. And healing does not just occur in the hospital, but also in the home. And House of Hope has become that home.